Hello, everyone. Thank you for joining us again for our third medical Arabic session. Today, we're going to be doing a brief review of what we covered last time, and then we're going to continue on to our interview checklist. We'll be covering associated problems, past experiences with the symptoms, any positive or negatives, and a little bit about patient perspective of illness. So let's get started. So a little bit of review for palliative and exacerbating factors of the symptoms. First off is what makes it better, which is fi shi bikhafif. Fi shi is what or what is. Bikhafif is makes it better. And then the opposite of that is what makes it worse. So it still starts with fi shi, but this time it's bizid al-waja, what makes it worse. Bizid is increases or makes it worse, and then al-waja is just pain, which hopefully you should know by now. All right, here would be some sample responsive of palliative and exacerbating factors. So overall, when is lamma. When is lamma. And then after, when you say lamma, you want to add that the verb that you do that changes the pain levels. So first off is when I eat is lamma bakul. So lamma is when, and then bakul is I eat. Next up is when I drink. Lamma bashrab. Bashrab means I drink. After that is when I rest. So I rest is bertah. I know sometimes it's hard to get that that very airy H sound, but yeah, practice makes perfect. Just imagine it being lower in your throat. So for example, if you see those old Coke commercials, they drink the Pepsi and they're like, ah. So imagine that. When I rest is bertah. Next up is when I walk or run. So I walk is bemshi, bemshi, and I run is barkud. So when I walk is lamma bemshi, and when I run is lamma barkud. And last thing is when I sleep. Lamma banam. I sleep is banam. Lamma banam. All right, and if you want to ask them about any other associated symptoms, this you would say fi arad tenya. So arad means symptoms, and tenya is other. Fi arad tenya. Do you have any other symptoms? All right, some new content is past experience with these symptoms or this disease. So first off, you would ask, has this happened before? So has this happened is sar hek. Sar hek, has this happened? Min qabl. Min qabl means before. Some dialects, they drop that heavy K sound, the ka sound. They just say min abl. So whatever works with you, you can say min qabl or min abl. That means before. And again, this is going to be the same exact words as we talked about before, min abl or min qabl. But in this case, it's going to be what helped you before. Shu sadak min abl. Shu sadak means what helped you. Sadak means helped, and shu means what. Have you taken any medication? I know we covered this briefly in the past. Medicine or medication is dawa or dawa. So to say a dawa, that means any medication. So you can think of a as almost like any, except instead of the N being in the middle, there's another Y. A dawa is any medication. Have you taken is gendered. So some languages that you might have experienced in the past is also gendered. So akhat or akhati, if you're female or talking to a female, you would say أخذت or أخذتي أي دواء. Have you taken any medication? All right, a little bit about patient perspective as well. So you'd ask the patient, what bothers you the most? So the most is أكتر. So أكتر شيء is the most thing. أكتر شيء. So شو is what, you should know that. So شو أكتر شيء زعجك or مضايقك. So these are just two separate ways that people say what bothers you the most. So you can say زعجك or مضايقك. زعجك or مضايقك. So put it all together. شو أكتر شيء زعجك, or you can say شو أكتر شيء مضايقك. What bothers you the most? And then you should always ask the patient, what do you think the reason of this illness is? So you can get an idea of what they're thinking it might be. So a new word is السبب. السبب is reason. شو again is what, and then برأيك means what do you think or what is your opinion. And then السبب. شو برأيك السبب? What do you think is the reason? And lastly, we just wanted to touch base on why does Med-Arabic matter? With a brief story, some of the people on the board went to this conference called Med Global, a great organization, highly recommend if you're interested in global health. But one of the doctors was overseas, and she recognized she didn't know how to speak Arabic, but she briefly took a class in the past. So she recognized exactly one word, harara, which means fever. And she was able to help the patient and get them what they needed to get just from being able to understand this one word. So even if you learn one word, whether it's fever, harara, whether it's waja or pain, you can always make a difference in a patient's experience in the hospital. So thank you for joining us today. Definitely take all the time you need to practice. Use it or lose it. Practice makes perfect. Those things do actually have a meaning and they do help out. So yes, thank you so much for joining us. See you soon.